Thank you for the introduction. Yeah, my name is Kayleigh. I'm a community pharmacist and I also work for Community Pharmacy Wales. So Community Pharmacy Wales, very similar to sort of GP practices, all community pharmacies are private businesses, but we work under an NHS contract, and Community Pharmacy Wales negotiates that contract on behalf of the pharmacies in Wales with Welsh Government. So we are responsible for that contract and those negotiations with Welsh Government. My role, I go out and visit community pharmacies, make sure that they're up to date with everything that's happening with the contract, and support them with whatever they need, really. So the title's a bit misleading because it's what's new in community pharmacy. So a lot of what I'm going to be speaking about today probably won't be brand new to a lot of you, but there have been some subtle changes because our new contract was launched in April last year. So I just wanted to talk a little bit about what's been happening, really, and how as patients you can access services in community pharmacy and what might be slightly new about them. If I could ask you, Claire, next slide, please. I'll do my Matt Hancock impression. So these images will probably be the most familiar to people when they think about community pharmacies. So dispensing medicine safely and efficiently has been sort of the mainstay for community pharmacy for well over 70 years. The community pharmacies have supported the NHS to ensure that people can access medicines when they need them safely and efficiently. Next slide, please, Claire. More recently, and particularly since 2005, we had reforms to our community pharmacy contract in 2005, which created a platform for an increasing range of clinical services to be provided by pharmacies. And since these reforms, and in particular over the last 10 years, there's been sort of a shift in the expectations of the NHS, the public, as to the role of community pharmacies and the role that we can play in improving health and well-being, with a much greater focus on the provision of clinical services alongside the traditional role in supplying medicines. So next slide, please. Since April last year, we launched a clinical community pharmacy service, which is a national directed service, which means it's available across all 710 community pharmacies in Wales. So basically what we've asked pharmacies to sign up to is to say that they'll provide 4 services regularly in the community pharmacy. And these 4 services are the common ailment service, the flu vaccination service, emergency contraception, and emergency medicine supply. So I just wanted to talk a little bit more about these services today, and other national services that are really important to us at the moment is the discharge medications review, and also the brand new independent prescribing service, which was again launched in April 2022 and has been a big success and has been very important to the communities that it's been launched in. So I wanted to speak a bit about that today as well. So next slide, please. And next slide again. So the common ailment service, this was launched actually in 2016. So some of you or all of you may already know about it, and it's where pharmacists and pharmacies can offer advice and provide medicines free of charge for a list of 27 common ailments, which are listed on the screen here. So a really, really good service. I mean, previously patients will have accessed their GP to get treatment for some of these conditions, which obviously takes up the GP's time. So by moving this into the community pharmacy and providing treatments for these ailments in the community pharmacy for free, we've sort of helped to sort of shift some burden off GP practice, hopefully, and make it a lot more accessible for patients as well, which is obviously the most important thing. It's a really successful service, and we're doing around about 20,000 consultations a month in community pharmacies in Wales at the moment for the common ailment service. So it just shows you how popular it is. In the last column on the screen, you can see sore throat is listed there. So we've recently launched, next slide please Claire, we've recently launched this sore throat test and treat service, and some of you may have heard about this, particularly over Christmas with the scarlet fever scares, but it's basically a service whereby if you've had a sore throat for over a week, or if it's a particularly severe sore throat, persistent sore throat, you can come into the community pharmacy. The pharmacist will assess you, and if it's appropriate, they'll take a throat swab, a bit like a PCR test. So it's a rapid point of care test and a test for strep A. So if it comes out as positive, antibiotics can be supplied to the patient by the pharmacist. If it comes out negative, you'll be advised on self-care, and the pharmacist can also supply analgesia, so paracetamol or ibuprofen, free of charge then. Next slide, please, Claire. So the seasonal flu vaccination service, so I'm sure this is something that you'll all be well aware of. We've been able to provide this service for, I think it's about 9 years in community pharmacy now. We've had our best ever year this year in terms of the numbers that we've provided. I think we're up to about 150,000 vaccines so far. The flu vaccine service runs from September to March, so we're not at the end of the season yet. It's not too late to access the service if you haven't already had your flu vaccine. You can access the service free of charge if you're over 18, and if you have a certain health condition, are pregnant, over 50 years old. The range of conditions is extensive. So if you're unsure whether you qualify for a free NHS flu jab or not, you can check with your local community pharmacy and they should be able to give some advice. The cohort that we've been particularly asked to focus on, because uptake is particularly low in this cohort, is eligible social care staff. So generally the uptake is under 30% for this cohort. Carers in general as well. The uptake is particularly low, and we think that this is because it's quite hard to identify who is a carer and who isn't. It's easy to know if you're over 50 because obviously we have all those details on record, but identifying somebody who is a carer is quite difficult. So community pharmacies are uniquely positioned to identify these people, because we talk to people every day. We see carers picking up medications for the people that they care for. So we may be more aware than GP practices, for instance, if somebody is a carer. So yeah, this is a cohort that we've been particularly asked to look after. Next slide, please. So emergency contraception, again, nothing new about this service particularly, because we've been able to provide it for quite some time. So it's a service whereby where it can be accessed by patients aged over 13. If they've had unprotected sexual intercourse in the last 5 days, they can access the morning after pill. They'll be asked some questions just to assess whether the medication is appropriate for them or not, and they'll be given advice as well, and they can take the medication on the premises with a pharmacist. There has been a new element added just this year, which is bridging and quick start contraception. So this basically means that a longer term contraception can be offered to the patient when they access the morning after pill. 3 months of a pill can be given. You don't need to present for the morning after pill to access this bridging and quick start contraception. You can come in and ask for an immediate initiation of this contraception rather than waiting to start at your next cycle, for example. So a really, really good service. It's been a long time coming, probably, but I know not many people will be aware of this new addition to the service. So that's something that we're trying to promote as well. Next slide, please, Claire. Emergency medicine supply. So this is another great service. Again, it's been available for a long time informally, I would say, from community pharmacies. So you might run out of a supply of medication, and you might have traditionally popped into your own pharmacy and borrowed some against your next prescription. Potentially the pharmacy may have charged you for that emergency supply, but now this has become a national service, so it is free of charge. You can access it from any pharmacy in Wales. So if you've run out of your medication and you're away from home, or you've lost or damaged your medication, and it's, say, a weekend, you can go into your local community pharmacy and they are able to access your GP record to see your previously supplied medication, and then they can make a supply against that then. They can make up to a 30-day supply of most regular medication. Some medication is excluded from the service, which includes controlled drugs for obvious reasons, really. Yeah, so that's that one. Next slide, please, Claire. Independent prescribing. So I know this will be quite interesting to a lot of patients. So pharmacists can now train to become independent prescribers. We launched a national service, a national independent prescriber service from community pharmacies in Wales in April. So it basically builds on the two services I've spoken about, common ailments and contraception, but it's a much more extended version of that. Pharmacists can write prescriptions for you for a range of different things like acute conditions, minor infections, things like that. We've got about 110 community pharmacies in Wales providing this service at the moment. There's 710 pharmacies in Wales, and it's Welsh Government's ambitious maybe plan to have all community pharmacies providing this service in Wales by 2030. It's tricky at the moment because traditionally, as older pharmacists didn't qualify with this qualification to be an independent prescriber. So we've got to go back to university and do that qualification, which takes 6 months. All graduates from 2026. All pharmacy graduates will come out of university with that qualification. So after that point, we should probably see a bit of an exponential growth of independent prescribers in community pharmacy. But it's great because I think, as Jan pointed out earlier, GP partners are really, really difficult to come by. So if we can take sort of some of that burden off GP practices, then it gives them the opportunity to focus on, more chronic conditions than in GP practice. Yeah. Next slide, please, Claire. And the discharge medicines review. So you've probably had enough of my voice. So I've got a little video for you all to listen to now. It's only a minute and a half, but this should explain the service to you. If it works. There we go.
If you've spent time in hospital, you may have had changes to your medication or been prescribed something new. You may now have lots of medicines to manage, which can be complicated. After being discharged from hospital, it's important that your local pharmacy and GP practice are aware of any changes to your medication. To ensure that you're taking the correct medication when you get home and you're not having any problems with it, community pharmacies in Wales offer the Discharge Medicines Review service. Your pharmacy might ask you to register for this service so that if you do ever need to stay in hospital, any electronic information about your new medication will go straight to them. Some hospitals may give you written information to pass to your pharmacy, or you could always take along your new medicines directly to your local pharmacy. When you receive a new prescription, your pharmacy team will check this against the hospital information and make sure everything has been transferred correctly to your GP records. A few weeks after being discharged from hospital, they'll arrange a medicines review to make sure you're not having any problems with any of your medication. The review can be done over the phone or in person with you or your carer. The Discharge Medicines Review service helps patients who are having problems taking their medication or experiencing any unwanted side effects and helps prevent medicational errors, which can put you back in hospital. It helps keeps patients safe, makes sure they're getting the most out of their medication, and saves money for the NHS by reducing hospital admissions. Remember, if you are due to go into hospital or have been treated in hospital recently, make sure your local pharmacy team know so they can help keep you safe. Visit your local community pharmacy today to register for the service.
Thank you, Claire. Yeah, so this is one of my favourite services because it's so important. Obviously when you went to hospital, you might have changes there to your medication. This is obviously then noted in a discharge summary, which comes out with you from hospital. And the community pharmacy normally receives a copy of this. So it's basically a service whereby we take a look at that discharge, we look at your prescription to make sure that there's your first prescription after you leave hospital, just to make sure that there's no transcribing errors. And if there are, we'll go back and liaise with the GP practice. If there aren't, great, we'll dispense you medication, and then we'll have a little chat with you about it then, just to make sure that you're happy with the changes that have happened, and we'll catch up with you a month later then to make sure that there aren't any ongoing issues with that new medication. So really, really important. I mean, every patient should have this service when they come out of hospital, but not everybody does. Sometimes it gets missed by the pharmacy because we're not aware that somebody's been in and come out. And I think the awareness of this service isn't there really with patients. So it's a service that we really want to promote and make patients aware of, because it is a really great service. And I think that's it. That was the last slide. Thank you all for listening.